All right, let's jump into a deep dive on something I think a lot of us have a personal history with: acne.
It's definitely something that comes up all the time in dermatology.
And, it's one of those things where even if it's like, quote unquote, just a cosmetic issue, it can really mess with your confidence. So let's break it down. What exactly is acne?
Well, at its heart, it's about your hair follicles. Those little openings all over your skin getting clogged up.
Right, the pores.
Yeah, exactly. They get filled with this combination of oil and dead skin cells, and it basically creates like a traffic jam in there.
Uh-huh.
And then, depending on what's causing the blockage, you end up with those different types of acne. The blackheads, the whiteheads, those angry red bumps we call pimples, and even those deeper, more painful ones, the cysts and nodules.
Okay, so we've got the usual suspects there. But what causes this poor traffic jam in the first place? I mean, is it really just hormones, like everyone always says?
Hormones definitely have a part to play, especially when we're talking about teenagers, but it's not that simple.
There's more to it.
Acne is really multifactorial. There are so many things that can contribute. It's like a puzzle with pieces that can be genetic or hormonal. Even things like stress or certain medications can be a factor.
So it's not just a teenage problem then?
Nope, not at all. While it's super common during adolescence, acne can affect people at any age.
Oh, wow.
And you're right, it's so much more than skin deep. I mean, it can really knock someone's self-esteem and even lead to scarring if it's not properly taken care of.
Scars are definitely not what you want, especially if the acne is gone. So when you're, trying to treat it, where does a dermatologist even begin?
Usually the diagnosis itself is pretty straightforward. We can visually assess your skin, identify the types of lesions and how severe they are, whether it's mild, moderate, or severe. That kind of helps us figure out the best way to go about treating it.
So it's really a case-by-case thing. No magic bullet.
Exactly. And sometimes, especially for women who are dealing with adult acne, we might recommend hormone testing. This can help rule out any underlying hormonal imbalances or conditions, things like polycystic ovary syndrome or PCOS for short, that might be contributing to those breakouts.
Right. So it's about getting to the root of the problem. Now, for someone who's just starting to notice breakouts, what are the first things they can try?
Well, for mild acne, those over-the-counter treatments can be a good place to start. You've probably seen benzoyl peroxide and salicylic acid in tons of products.
Oh, yeah, those are like the classic acne fighters. But to be honest, I always get them mixed up. What's the difference between the two?
So benzoyl peroxide is really good at attacking the bacteria that contribute to acne, and it helps dry up excess oil. It's like sending in a targeted strike force against those pimples. Salicylic acid, on the other hand, it gently exfoliates from inside the pore, preventing those clogs from forming in the first place.
So benzoyl peroxide is the fighter, and salicylic acid is more like preventative.
Exactly. Now, what happens when those over-the-counter options aren't really cutting it?
Time for the big guns then. Prescription treatments.
Right. For those tougher cases, moderate to severe acne, dermatologists will often go for topical retinoids.
Oh, yeah, retinoids.
These are interesting because they actually work by speeding up cell turnover. They bind to certain receptors in your skin cells and encourage your skin to basically shed those dead cells more quickly so they don't have the chance to clog up your pores.
So it's kind of like fast-forwarding your skin's renewal process.
Yeah, that's a good way to put it. There are also antibiotics, sometimes topical, sometimes oral, to fight the bacteria involved in acne. And then for women whose breakouts are linked to their hormones, there are hormonal therapies, like certain types of birth control pills that can be really helpful.
Gotcha. And then, of course, there's isotretinoin, which always seems kind of mysterious.
Yeah, that one has a bit of a reputation. It's super effective for severe, stubborn acne, but it's a strong medication with potential side effects, so it's really reserved for those tough cases and requires close monitoring by a doctor.
So it's not something you jump into lightly. Are there any other treatments out there, for people who haven't had success with those more common ones?
Definitely. There are a lot of what we call advanced treatments that target acne in different ways. Things like laser therapy, chemical peels, and light therapy. For some people, these can be real game changers.
Let's dive into those a little. What about laser therapy? What exactly does that involve?
Well, basically, laser therapy uses focused light energy to target specific areas of your skin. It kind of depends on the type of laser, but it can do things like destroy acne-causing bacteria, reduce oil production, or even help with scarring.
That's pretty high tech.
It is, and it's often a good option for people with moderate to severe acne who haven't seen results with other treatments.
So what about those chemical peels? They sound a little intense.
They might sound scary, but they're actually a controlled way to exfoliate the skin. It removes the top layer, and you end up with smoother, clearer skin underneath. And there are different types of chemical peels with different strengths and depths of penetration, so your dermatologist can recommend the right one for you.
So it's not like one giant peel-off mask for your whole face.
Not quite. It's a bit more precise than that, usually focusing on specific areas where the acne is the worst. Then there's light therapy.
I've heard about that. Is it similar to laser therapy?
They both use light, but in light therapy, it's usually a broader spectrum of light, like blue light to kill those acne-causing bacteria, or red light to reduce inflammation and help the skin heal. It's often used alongside other treatments and can be really helpful for people with mild to moderate acne.
It's incredible how many different options there are for treating acne these days. It's not just about harsh cleansers and spot treatments anymore.
It really isn't. And, all these treatments are great, but what about what we put in our bodies? Can diet actually make a difference in breakouts? I feel like I've heard so many different things about that.
Right. Should we be avoiding dairy?
Yeah.
Cutting out sugar? Is there actually any science behind all of that?
There actually is. There's more and more research coming out that shows a link between what we eat and how our skin behaves.
So it's not just an old wives' tale.
Not at all. There are studies that have shown that those high glycemic diets, the ones packed with sugary drinks, white bread, all that processed stuff, can actually make acne worse.
Really?
Yeah, it seems like those foods can spike your blood sugar, and that kind of sets off a chain reaction of inflammation, and that inflammation can trigger breakouts.
So you're saying my daily donut might be contributing to my skin issues.
Mm-hmm.
Is there any wiggle room there?
Well, like with most things, moderation is key.
Yeah.
But honestly, switching to a lower glycemic diet, one that's full of whole grains, fruits, veggies, lean proteins, has been shown to make a real difference for a lot of people. Interesting.
Some studies have even shown a reduction in acne severity by up to 50% just from dietary changes.
Wow. Okay, that's pretty convincing. What about dairy? I've always heard that can be a trigger for some people.
That's another one that's getting a lot of attention. Research suggests that dairy, particularly skim milk, could be linked to an increased risk of acne.
Interesting.
It's thought that it might be the hormones that are naturally found in milk that are the culprit, but we need more research to really understand how it all works.
So if you're prone to breakouts, maybe cutting back on dairy or trying those plant-based alternatives is worth a shot. Now, what about those good fats, like the omega-3s? Those are supposed to be good for your heart, but can they help our skin too?
Absolutely. Omega-3 fatty acids, you find them in things like fatty fish, flax seeds, and walnuts. They have some seriously powerful anti-inflammatory properties. And since inflammation is kind of at the heart of acne development, getting those healthy fats into your diet might help calm everything down. So we're talking diet. And what about lifestyle? Does stress actually worsen acne? Or is that just like a myth?
Oh, that's definitely not a myth. When we're stressed, our bodies release hormones like cortisol, and that can actually ramp up oil production, which leads to, you guessed it, more breakouts. It's that mind-body connection in action.
Stress really just makes everything worse. So besides quitting my job and living on a beach somewhere, what can we actually do about it?
Well, while a tropical getaway might be nice, there are definitely some more practical things you can try. Regular exercise can help, getting enough sleep, and things like mindfulness practices, yoga, meditation, all of those can help lower those stress hormones and potentially lead to clearer skin.
Makes sense. So we've covered diet, stress management. What about the actual skincare routine? Does that play a role in preventing breakouts?
It plays a huge role. Using the right products and being gentle with your skin is essential. Start by choosing a cleanser that's non-comedogenic, which just means it won't clog your pores. You'll usually see it labeled that way. And please, I beg you, resist that urge to scrub your face.
What, really?
Yeah, being rough with your skin can irritate it and actually make the acne worse.
So no more harsh exfoliating scrubs. Bummer.
Well, gentle exfoliation is fine. Just avoid anything that feels like sandpaper on your skin. And don't forget what we talked about earlier. Sunscreen is essential. Sun damage can worsen acne and make scarring more likely, so wear it every day, rain or shine.
Yeah, those UV rays are sneaky, even on cloudy days. What about picking at pimples? Is that as bad as everyone says it is? Because I have to admit, sometimes I just can't help myself.
I know, it's so tempting. But picking or squeezing those pimples can really backfire. It can actually push bacteria deeper into the skin, spread the inflammation, and make scarring more likely. So, as hard as it is, try to leave those blemishes alone.
All right. All right, I'll try my best. So basically, a holistic approach is key when it comes to preventing acne. We got to take care of our bodies from the inside out, manage stress, and really be mindful of our skincare routines.
Mm.
But what about after those breakouts happen? Is there anything we can do to, like, minimize the after effects, like scarring?
That's a really good question. Aftercare is so important. It's all about helping your skin heal, minimizing the chances of scarring, and preventing those post-acne marks from sticking around.
Okay, so what are the secrets? How can we help our skin recover?
Well, the most important thing is to keep being gentle with your skin. Stick with that non-comedogenic cleanser and avoid any harsh scrubs or exfoliants while it's healing.
Right, gotta let it do its thing.
Exactly. And as tempting as it is, try to resist covering up those red marks with heavy makeup right after a breakout. It can actually clog your pores and slow down the healing.
So even if you're self-conscious about it, it's best to just let those spots breathe.
I know it's hard, but yeah, your skin will thank you in the long run. Now, about those post-acne marks, what we call post-inflammatory hyperpigmentation, the key there is patience.
Easier said than done.
It really is. But those marks are basically areas where your skin's producing more melanin because of the inflammation. They usually fade over time, but there are things you can do to help speed things up a bit.
Okay, like what? Give me the secrets.
Well, topical treatments that have ingredients like vitamin C, niacinamide, or retinol can be really helpful. They can brighten the skin, reduce inflammation, and encourage cell turnover, which all help fade those marks.
So it's about adding those ingredients to your routine.
Right. And of course, sunscreen is still non-negotiable. Protecting your skin from the sun is so important to prevent those marks from getting darker and harder to get rid of.
Because sun exposure can worsen any hyperpigmentation, not just from acne.
Exactly. And if those marks are being really stubborn or you're looking for something a little faster, there are also in-office treatments like chemical peels or laser therapy that can target the hyperpigmentation more directly.
Sounds like a lot of different ways to deal with those post-breakout issues.
There are. And even though we've covered a lot today, acne can be tricky. It's always best to chat with a dermatologist to get personalized advice and a treatment plan that's right for you.
For sure, they can really help you figure out all the options and what'll work best for your skin. Wow, we really went deep on acne today. It's amazing how much there is to know about something that seems so common.
It really shows how complex our skin is.
Absolutely.
Okay.
So to recap, the biggest takeaway is that acne is super common, but it is treatable.
Absolutely. And it's not one size fits all. It often takes a bit of trial and error working with your dermatologist to find the right treatment plan for you.
Right. What works for one person might not work for another. We also learned that acne isn't just about what's happening on the surface. It's influenced by, well, pretty much everything. Our genes, our hormones, what we eat, how stressed we are, even our skincare routine.
It's all connected. That's why managing acne effectively often means taking a multi-pronged approach, tackling both those internal and external factors.
It's about overall well-being, not just spot treatments and quick fixes.
Exactly. Nourishing your body from the inside out, managing stress, and creating a gentle, consistent skincare routine that supports your skin's health.
Couldn't have said it better myself.
Yes.
This has been such an insightful conversation. I feel like I have a whole new perspective on acne and how to get and keep clear, healthy skin.
I'm glad to hear that. And remember, knowledge is power when it comes to your health.
So true. And to our listeners, thank you so much for joining us on this deep dive into the world of acne. We hope you found it informative and helpful.
It's been great diving deep with you.
And remember, don't hesitate to reach out to a dermatologist if you have any questions or concerns. Keep learning, keep exploring, and keep taking care of your amazing skin.